David De La Fuente here again, and I wanted to follow up with you again from the workshop. I know another big problem that a lot of people will have and that they will anticipate is money. Isn't physical therapy expensive? Relatively speaking, it is significantly less expensive than almost every other option out there. It is about 1% of the cost of surgery. Actually, a full treatment plan for physical therapy is less than one injection or one MRI on average. That is pretty cool. I know that we have a lot of problems in healthcare right now revolving around how expensive that things are, but physical therapy is one of the least expensive options out there with regards to the price. I'm really sensitive to this because for 13 or 14 years now, we have had high deductible plans for my family and I. So the first couple of $1,000s every year, we have to pay that out of pocket before insurance picks up anything. What we did is we went back about 6 to 7 years ago and we created the most flexible payment plan or financial policy that we could to try to help people out as much as possible. Now obviously, you know that I have never waived the copay because if I were to do that, I could violate the contract that I have with the insurance company. Same thing with the deductible. We couldn't possibly do that, but I want to explain our financial policy with you and what we could do to help people with back pain and sciatica that we work with as much as possible. The first thing that we do is we participate with every major insurance company that we are allowed to participate in this area. So that includes Medicare, Blue Cross Blue Shield, United Healthcare, Aetna, and Oxford, just to name a few. Just about anybody that you can name, if we can participate with their insurance plan, we do that. That is the big benefit for most people. The majority of people here are insured. If you are not insured, I will get there in a second. It is really tough to say one sentence here and cover everybody, but if you have any questions at all, you can just reply back to this email. I will get you in touch with our insurance department that will easily explain exactly how your insurance works and also if you would owe anything like a deductible or copay and what that would look like. The second thing is we design our treatment sessions to maximize your time and to get the best value of your personal costs. Meaning we focus on things we have to do for your own good. We perform our hands-on treatment, teach you new exercise, and answer any questions. We will not waste your time with things you could have done at home. We will not work with multiple patients at once so we can pay attention to you during every visit. Not all physical therapy clinics do this. The third thing that we have is some people, about 20% of the people that we see, don't have insurance at all, so they are strictly cash pay basis. I can tell you this, just from surveying other physical therapy places in the area, we are offering the best value cash pay rate that is allowed legally. The one-on-one time you get with the physical therapist can't be beat for the cost. We are not the cheapest, but we are not the most expensive either. However, we offer the most one-on-one time with the physical therapist in the area. The reason that we did that is this. Maybe you are skeptical or you were thinking that we are desperate for patients or something like that. Truthfully, we have people that drive from New Jersey, New York, Pennsylvania, Connecticut. Yes, even people from Texas and Florida will drive for the best physical therapy. You might be a little bit skeptical and say, why would we possibly do that? Well, again, if times are tight and you are stretched financially, I know what that feels like. Just because I have been through it myself. That is not a very good feeling. Suffering with back pain and sciatica is not a good feeling either. We can design a treatment plan that will address your problem and get you feeling better whether you have insurance or not. Our philosophy is this: provide the best physical therapy plan to address your problem whether you have insurance or not. If you still want to take me up on the free exam, just reply back to this email and I will make sure that you will get taken care of.